What are some of the symptoms that you see when you say odd symptoms that
Mm,
progress?
yeah. So, for example, in some of the forms of the NCLs, they might have an onset that we call late infantile onset. So that tends to be more on like the toddlerhood ages, so between like 2 and 4. So they will have their symptoms start around 2 or 4, and it might be seizures as the first symptom, or maybe some cognitive changes as the first symptom. And then over time, they kind of unfold, and you expect to see some motor challenges, and then vision might be a little bit later, and some of the more classic late infantile kinds of presentations. But we're also finding that there might be people who come out where they had seizures that started in their teenage years. And then a little bit later, they had some motor difficulty that came up, but many years later. And so it's the symptoms themselves are odd more in that the way that they present so much later and so much more slowly.
Interesting. So you're saying that these adults probably could have potentially had these symptoms as kids and just not been identified with.
Or that they might not, they might have some kind of thing where they start later, but because of the gene mutation itself, it has a later presentation. And so in the past, if nobody had genetic tested these people, we might never have gotten the diagnosis.
So, what comorbidities typically play along? We've talked a little bit about anxiety and things of that nature. Are there
Mm-hmm.
any other comorbidities, like with immunity or with any other kind of things? I think you mentioned vision loss, but that
Mm-hmm.
seems to be the result of the
Mm-hmm.
neurodegeneration itself.
Yeah, yeah. So, in some ways, it probably depends on the specific NCL, but one of the things that we will see is there can be quite a bit of anxiety. There can also be quite a bit, especially in some of the forms like CLN3 disease, which I have mentioned before is the area that we focus on a lot. Some of these kids will have a lot of obsessive kinds of symptoms, and they will also have some perseverative symptoms. So, obsessions being these kind of unwanted, intrusive thoughts that happen over and over. Perseveration being more they get stuck on topics. They're not necessarily unwanted topics, but they can still cause some problems in the family if you just can't move on from the topic. So those kinds of behavioral things can come out quite a bit, and I do think that it's part of the overall brain disease because the brain itself is undergoing a lot of changes. It's a degenerative process, so it probably all relates. But that's an area that we still need to better understand because a lot of these children, they have cognitive changes too. And so being able to better understand and define the kinds of psychiatric symptoms they have can be really challenging in children with developmental disability and dementia.